Good afternoon and good morning, everyone, and welcome to the latest installment of EMS Focus, a collaborative federal webinar series. My name is Noah Smith. I'm an EMS specialist in the Office of Emergency Medical Services here at NHTSA, the National Highway Traffic Safety Administration. Thank you so much for joining us today. Together with our federal partners, our Office of EMS is focused on advancing EMS systems across the nation. The projects we undertake and the resulting resources for the community help you and your colleagues plan for system improvements and to measure the health of EMS systems nationwide. And we deliver the data and information that EMS leaders need to advance their individual agencies, states, and systems. Another role of our office is to educate the EMS community on new innovations, processes, technologies, and topics like you'll hear about today that can, in the end, help provide better and more efficient patient care. And this free webinar series is a great opportunity for federal agencies to share information with the EMS community, obviously in a way that is a little less time-consuming and less costly than attending conferences, but offers the community the opportunity to interact directly with us and ask questions that a newsletter or an article obviously doesn't provide. The EMS Focus series conducts webinars several times throughout the year on issues that are important to the community and provides timely information about what federal agencies are doing about them. Today's topic is particularly timely, which you'll hear about in just a moment. Our webinar today is being recorded and will be archived on ems.gov for your future viewing and listening pleasure. Of course, more information and to review the archive of all the of all the past EMS Focus webinar series can be found on our website, ems.gov. So today we're going to be talking about the intersection of local EMS and national policy, and one way to ensure that your voice is heard in Washington. This month marks the 10-year anniversary of the formation of the National EMS Advisory Council, or NEMSAC. Dozens of people from across the country have served on the council during the past decade, representing the diversity of the EMS community and advising the U.S. government on national issues related to emergency medical services. During that time, the Council has worked to support the profession through open and thorough discussion and by making recommendations on topics ranging from the EMS culture of safety to the education system to data collection and community paramedicine and many other topics. And in today's webinar, we're going to reflect on the impact that NEMSAC has had on national policy, but also local and state policy, and share how to apply to be a NEMSAC member yourself and represent our profession here in Washington. Our webinar is going to be as interactive of a discussion as possible about what NEMSAC is and why it was formed, and again, how you can apply very shortly to be appointed to be a member of the council. We'll also learn about some of the work that NEMSAC does and why it's a great opportunity for the community's voice to be heard at the federal level. And we'll review some examples of the real-life impact that NEMSAC has had on the nation's EMS system. Finally, we'll hear about some of the committees that NEMSAC is working with right now and the work they're doing to improve EMS across the country. Attendees are going to be in listen-only mode throughout the hour, but you're encouraged to submit questions through the webinar platform at any time during the discussion. And we've reserved about 15 or 20 minutes at the end to go over those questions and get to as many as we possibly can. We have a great panel of speakers today to share their experience on NEMSAC and the great work that it does. I'll introduce all three of them and then we'll start our discussion. So Dr. John Kramer is my boss and serves as the director here at the Office of EMS at NHTSA. He joined us last September. He's board certified as an emergency and EMS physician and has been actively involved in EMS for over 30 years, first in his home state of Michigan, and then at the national level as an active member of the American College of Emergency Physicians and past president of the National Association of EMS Physicians. Aaron Reinert is the executive director of Lakes Region EMS, a rural ambulance service serving Minnesota and Wisconsin. Aaron has been a paramedic for over 20 years and has served on the board of directors for the National Registry of EMTs, Advocates for EMS, and the National EMS Management Association. Aaron was appointed to serve as a member of the very first NEMSAC in 2008 and later served as chair of the council from 2011 to 2015. Vince Robbins has been the president and chief executive officer of Monarch, New Jersey's largest EMS and mobile healthcare service hospital cooperative since 1990. He's a fellow of the American College of Healthcare Executives and serves as the president of the National EMS Management Association, as well as on the editorial board of EMS World Magazine and as a board member of the North Central EMS Cooperative. Vince was appointed to NEMSAC in 2015 and has been the council chair since last year. And finally, I'm Noah Smith with the NHTSA Office of EMS. I'm going to be serving as your moderator today. So real quickly, a little background on NEMSAC, or the National EMS Advisory Council. 10 years ago this month, in 2007, NEMSAC was established as a federally recognized council of EMS representatives and consumers to provide advice and recommendations regarding EMS to NHTSA and the U.S. Department of Transportation, as well as many members of other agencies throughout the government. NEMSAC provides advice and recommendations both to DOT and to something called FICOMS, the Federal Interagency Committee on EMS, which has representatives from Health and Human Services, Homeland Security, the Department of Defense, and the Federal Communications Commission. NEMSAC is comprised of 25 members of the EMS community, each representing a particular sector of EMS, such as hospital-based EMS, fire-based EMS, state EMS directors, pediatric emergency physicians, EMS medical directors, public health, research, so on and so on. The members meet in DC up to 4 times per year to provide recommendations or advice on EMS topics. And our presenters are going to share a few of those specific recommendations that NEMSAC has developed over the years a little later in our webinar. NEMSAC is the only federal advisory committee focused solely on the needs of the EMS community. It's actually a luxury that a lot of industries and sectors of healthcare don't share with EMS. It is truly your most direct voice to national policymakers in Washington, and recommendations from NEMSAC are powerful. They can be acted on by the federal government almost right away. Members of NEMSAC are appointed by the Secretary of Transportation in close consultation with the Secretaries of Health and Human Services and Homeland Security. Appointees serve 2-year terms and may be reappointed to serve 1 additional successive term. And the current NEMSAC membership is coming to an end, actually this summer. And a new council is going to be appointed in the fall. With that, I'd actually like to hand it over to Dr. John Kramer to talk about an incredibly timely and wonderful opportunity for each of you to learn more about the NEMSAC application process that's opening really soon. Dr. Kramer.
Thanks, Noah, and thank you to everyone for joining us today. As one of the panel members and all of us are looking forward to talking with you about the activities of NEMSAC, but I want to first chat for just a minute or two about how to apply. As Noah indicated, the term for the current NEMSAC members is ending this summer, and new members will be appointed this fall. The application period will cover the 2017 to 2019 Advisory Council. Because this is a federal advisory council, we need to provide publication in the Federal Register, and we're extremely hopeful that that publication will actually occur within the next couple of days. When the Federal Register notice is available, we'll be sending out an announcement to all of the subscribers to NEMSAC News. And as you can, we'll flip over to the next slide. You can see on that slide, everyone's available to sign up for email updates on the NEMSAC portion of ems.gov by clicking on the Receive Email Updates that's highlighted in the upper right corner. That area, once you go to that, will provide detailed information about the application process and the requirements for NEMSAC membership. The application should include a cover letter and an explanation of why the individual is seeking application as a NEMSAC member. We need to include a resume or CV, a short biography of professional and academic credentials, and at least 1, but potentially up to 4 letters of recommendation, as well as an affirmation statement that the applicant is not a federally registered lobbyist. And all of that information will be included on the website when you click over to it. It's preferable that all applicants are sent, or all applications, are sent via email to the nemsac@dot.gov site, but they can also be faxed or mailed. as long as they are received by the deadline, and we expect that deadline will be June 16th. That also will be specifically outlined in the Federal Registry notice. Applicants selected for appointment to NEMSAC will be notified either by email or by letter of appointment. And those will come after all the applications have been reviewed and completely approved by the Secretary of the Department of Transportation. Noah, back to you.
Thank you so much, John. I mean, this is really an incredible opportunity to not only learn about what the NEMSAC has accomplished over the last 10 years and hear from two previous and current NEMSAC chairmen, but also your call to action today, right, is to sign up for email updates on ems.gov and be ready to submit your application to serve your profession as a member of the National EMS Advisory Council. With that, we'd like to begin our discussion, and I'm going to start with introducing Aaron Reinert, and asking him a couple questions about his experience with NEMSAC. And Aaron, I'm going to begin by noting that you're a pretty busy guy. You run a large EMS system. You have responsibilities to your community and to your staff and to your family. What was your motivation to take time out of your schedule to serve on NEMSAC, and what do you think you got out of it?
Well, thanks for the question, Noah, and good morning or afternoon to everyone. When NEMSAC was first formed and I thought about joining or submitting an application for consideration to join the council, I really thought about my ability to bring my voice amongst many others to really help lead and shape our nation's EMS system. As a paramedic, and I still practice today and have an opportunity still to work ambulance shifts, during my day, I might affect a few patients' lives. As a leader, manager, director of an ambulance service, I might have the opportunity to help shape the type of response that we provide to our 10,000 some patients. But as I thought about NEMSAC, I thought about the 30+ million ambulance calls that our nation's ambulance services respond to, and thought about the ability to help shape our nation's EMS system and help play some small role in how our nation's EMS system serves those 30+ million responses we go to every single year.
It really is an incredible responsibility and a wonderful opportunity. Thank you. Now, Aaron, you also served as a member of the council for a long time, and you served as its chairman for several years. You have this like incredible perspective, right, of seeing the NEMSAC grow over time and evolve and mature, but also watching the industry grow and mature over the last 10 years. So thinking back, can you reflect a little bit on the power that the council has? So the council doesn't regulate anything. The council can't force anyone to do anything. It's just words we're talking about. But can you talk a little bit about the power that you think the council has had in terms of the influence both on the government, but also back towards the industry itself?
Certainly. And the first question, I think the latter question, weave a little bit together. So as I reflect on my opportunity and the honor of having served on the council from 2008 until 2015, the first thing that really stands out in my mind is as an individual, personally and professionally, it was and continues to be a life experience that'll really never be able to fully repay. The opportunity to sit with 25 individuals from all across our nation, many of which changed every few years as council members' terms expired. The chance to sit with those brilliant minds and learn about all kinds of aspects of our healthcare system, both personally and professionally, has really deepened and enriched my understanding of our EMS system in ways that I don't know that I can fully even express. I certainly learned about parts of our EMS system at the local regional, state, national level that I certainly might have understood on the surface, but have such a much deeper, broader understanding, benefits me again in my day-to-day opportunities running an ambulance service in the national organizations that I serve with. But as really a council member and as a chairman, what I really saw as the greatest strength, the greatest effectiveness of the council was not necessarily the work that it did. Well, I certainly think the work was incredibly important, and the recommendations from the council really sparked many projects, one of which is currently in process, which is the EMS 2050 project. But there were many others, such as the Culture of Safety project and many of the projects that happened around data and information. But I really saw the power, the strength, the effectiveness of the council being starting, supporting, fostering, encouraging national conversations around subjects. The council doesn't have operational power. It's not able to make the EMS system do anything, but yet the conversations that the council facilitated, fostered, supported, encouraged have shaped our EMS system, and I think ways that are truly measurable, meaningful, and actionable. Really three kind of notions that came out of the council as it began to think about its work. And I think one of the other real strengths of the council, and it has been really from day one, from all of our chairmen, our first chairman, Dia Gaynor, myself, John Sinclair, many others, as well as Vince, have really been to ensure that all voices can be heard. And whether it's people who are on the council, people who submit to the council, people who attend council meetings, our federal partners, our national associations, all of the voices, I think, bringing them to a single spot to have a national conversation about our industry is incredibly powerful. As we speak with one voice, I believe we have the ability to really advance our nation's EMS system.
I agree, Aaron, and I think that's beautifully said. One of the major priorities that came out of the council while you were a member very early on was around safety. And we've got a couple minutes. I'm wondering if you can just bring us back to those early meetings in 2008 and 2009 and tell us a little bit about the discussion of sort of how safety bubbled up to the top of the priority list and why it was so important for that group of folks to highlight safety for the profession.
I'd love to. So I remember it well. So as we began our work and as our first chairman, Dia Gaynor, led us through a process to really begin to shape what would be the things we would work on. We used one of the standard kind of meeting facilitation processes of brainstorming and lists and dottages. And as we were creating those lists, we shared all kinds of different aspects of our EMS system that could use improvement, could use conversations, could use attention. And it revolved around many of the topics you might think of. Operations, deployment, clinical standards, certification standards, reimbursement. Many of those things kind of through that popcorn process moved their way up. And one of our council members, which I think he is well known within our industry, is Gary Wingrove. And Gary was often soft-spoken during our meetings, but when he spoke, he really gained everyone's attention. And so as it came to his turn, Gary paused, reflected. I want to encourage us to think about safety. And everyone paused for a little bit, and he went on to talk about how we ensure that our system is not only safe for the practitioners that are providing the service, but safe for the individuals, that we're serving, the community that we interact with as our vehicles move throughout the community, and the list goes on. And understandably, that moved to the top of the list. And as we began to think about it and really understand how do we take a small bite, today the council would call that a bite that's meaningful, measurable, and actionable. And it's a difficult subject and it's a complex subject. And I was so proud of how the recommendation came forward through the council and how our federal partners really began to implement it through the Culture of Safety project, which began again with having a national conversation about safety. And I really believe that's helped to bring this issue to the table and continues to be on the table for us all to talk about through that very first meeting, that probably the very first day when Gary Wingrove said, I really think we should talk about safety. That conversation continued in every council from 2008 till 2015. And as I participate now as a non-council member in the council, I see it continue to come up in every piece of work the council does. It really has become almost a guiding principle for our industry as well as the council's work moving forward.
Yeah, I absolutely agree, Aaron. You know, I've been a provider for over a decade, and I've been with NHTSA's Office of EMS for 7 years. And I can tell you that just in that short time, I've felt the impact of these national conversations, both in my practice with my local fire department, but also in national conversations. I think a decade ago, safety was largely an afterthought for the industry. Something, you know, maybe we talked about once a year at an annual refresher or something, but it wasn't at the forefront of our conversations or our thoughts. I think today it is, and I think that's largely due to the work of you and your colleagues in the advisory council, forcing the conversation and being very professional about it. So thank you so much, Aaron, for that perspective.
And just to emphasize that real quickly, I think when we talk about something, it brings it from kind of the shadows, as you were alluding to right in front of us. And the safety issue has always been there, but now that we're talking about it, it's in front of us. And as we look at it and begin to measure it, we're beginning to see how large it is within our industry, both personally and professionally, from kind of mental and moral injuries, those difficult calls that our providers experience every day, as well as the things we easily think of, such as ambulance crashes, medical errors, and such. So thank you for your perspective as well.
Right on, absolutely. And I'm sure that Vince is chopping at the bit here to offer some of his perspective about the current NEMSAC and the tough conversations that they're having that are absolutely necessary for our profession to move forward. Vince, I'd like to ask you, as the current chair of the Advisory Council, how do you see the role of NEMSAC in sort of helping EMS systems improve? Not an easy task by any means, but what's your perspective?
Sure. Thank you, Noah, and good afternoon, everybody, and thanks for joining us on this webinar. I think on my perspective is pretty straightforward. The NEMSAC is an important group, as has already been explained, and I think how it directly affects EMS agencies and providers around the country is it provides a couple of things to the EMS industry. It provides a direct mechanism where agencies and practitioners can bring issues forward. You know, there's public comment period during our NEMSAC deliberations and meetings. There's also the ability for providers and agencies to submit information requests, items for consideration to the NEMSAC through NHTSA and the Office of EMS. And all of that is brought forward and as Aaron indicated, is discussed thoroughly. It also provides members of the EMS community and agencies really an access to national experts, individuals that do this all the time, that represent specific stakeholder groups throughout the country. And a particular issue in a person's neck of the woods, if you will, is important to them, and they can find an ear on the NEMSAC through many of our stakeholder representatives, where they can bring that forward, and it resonates with that individual NEMSAC member, and it finds a voice within the group, as Aaron alluded to, and we discuss it thoroughly. I think the other thing that's important is that agencies and providers throughout the country, by participating in NEMSAC, either by attending our meetings or following us and receiving the emails and participating in discussions, it gives providers and agencies in our industry exposure to a much broader array of what EMS is in this country, that expands far beyond their particular community and what their life experience is in their area. So this awareness, this ability to participate, this provides just a wealth of information and expertise for individual practitioners as well as agencies to address their issues, to address their problems, to bring them forward. And it allows them to see best practices and how NEMSAC and really this collection of 25 national experts, if you will, that keeps changing and enhancing over the years, can address those. So I hope that answers your question, Noah.
Yeah, it absolutely did, Vince. And you know, I began with my intro this afternoon by mentioning that NEMSAC is sort of a luxury, right? I think a lot about how much time and effort goes into this thing called NEMSAC, and it is really timely. It does take up a lot of resources. It is a bit of a production, right? But it's also this incredible luxury that a lot of our colleagues in the rest of healthcare don't have. I mean, put yourself in the shoes of a hospital administrator or just an average physician across the country. Do they have a direct line to federal policymakers in Washington? It's really not that simple for them. And so this opportunity to have your voice be heard is so important. And I can tell you that NHTSA and our partners across the government are really overjoyed to be able to support it. With that, Vince, we also want to talk about sort of what the NEMSAC is doing today. So you've been a member for almost 2 years now, and you've been intimately involved with several of the working groups and committees that NEMSAC has formed over the last few years. I'm wondering if you can spend a couple minutes going over the most recent recommendations that NEMSAC has adopted, and maybe talk a little bit about why those issues were chosen over others. Of course, there's so many things that we could talk about with our industry.
Of course, certainly will. Actually, if we could forward to the next slide, I think it's important to understand the structure of the NEMSAC. We have the 25 members or so that represent all of the different stakeholder groups, but we have working and standing committees, if you will, that address particular topic areas that have kind of surfaced over the years as kind of the core of our EMS community activities. And out of those committees, areas and items of extreme interest surface, they're discussed, and our NEMSAC members begin a process by which they dissect the issue, they investigate it, we seek expert opinion, subject matter expert information, we seek the expertise of NHTSA, Office of EMS, to bring information and data forward to us to consider. And then we generate what's called an advisory. And an advisory is really the culmination of all this hard work where we identify the issue, we examine it, get to root cause analysis, we banter about and debate what are ways to resolve these issues, how to address them, and we come up with an advisory which highlights all that information, and then it makes very specific, detailed recommendations to NHTSA and to FICMS about how to address these particular issues that we've identified. And I think there's an important theme that runs through the NEMSACs from when they began and the first appointees and the first chairpersons up until today. And there's a continuity that transitions from NEMSAC to NEMSAC every 2 years. There are particular themes that seem to never end and need to continually be updated and readdressed and refocused on. An example would be funding and finance. And I know in Aaron's time as chairperson, that NEMSAC addressed this. I had the pleasure of serving on one of the subcommittees at that time for Aaron's NEMSAC that addressed funding and finance. And I find myself today as chairman of the NEMSAC still looking at that issue, still addressing that issue, updating it, and providing new authoritative recommendations, if you will, to the federal agencies related to this critical issue of funding and finance that really permeates EMS, regardless of delivery model, throughout the United States. So that's kind of an example of an advisory that ties original NEMSACs to current NEMSACs. It just continues to flow. We continue to do the important work to update it, to readdress it, to bring in new information, and then modify our recommendations or add new recommendations as necessary to the federal government. And that's been extremely helpful in conversations the industry has had with the funding sources of EMS. In terms of the second area I see is that we address emergent or urgent issues that pop up, and we can create ad hoc committees. At the bottom of the slide, you see two, naloxone and replica. And these were topics that came to us quickly. NHTSA identified to us a question as an example related to naloxone, the opioid epidemic that we're seeing around the country. And we were able on the fly to put together an ad hoc committee, get members of the NEMSAC that were interested in that particular topic together. They worked diligently and hard, and they were able to produce an advisory rapidly to NHTSA about our recommendations related to the naloxone issue and how our EMS providers should address that and how training should be wrapped around that. And I think the third area of advisories is related to the new issues that surface that are coming about in our generation, if you will, of the NEMSAC.